afternoon all. So my topic is ERG and EOG for general ophthalmologist. So electroretinogram, it actually measures the stimulation of retina when the light falls upon the retina. So it is just the sum total of the various electrical activity which is occurring in the retinal cells. So just for the ERG setup, this is the Gansfield stimulator through which emits light, and patient looks upon this central fixates upon this central light and in a dilated state, and this stimulates the retina in a dark adapted state and in the light adapted state, which is so the electrical potentials generated by the retinal cells, it is recorded by these electrodes, and then these signals are amplified and then analyzed by the software machine, and finally we get the graph like this. So if we understand this graph, so we generally do two tests. First we make the patient dark adaptation, we keep him in a dark room for 30 minutes, and then we conduct this test. So there we get dark adapted waveforms here. So here you see you are getting these waveforms, out of which I will describe this one. So you see this is the A waveform and the B waveform. And then again, once we record a dark adapted state, then we shift the patient into a lighted condition. There he is light adapted for 15 to 20 minutes, and again the same test is repeated. And so the light adapted waveforms which we get, here we get two graphs. So here we see these are the 30 hertz oscillation waves which is seen in the light adapted state, and here also a wave and a B wave. So dark adapted state is done to study the rods, and the light adapted state is done to study the cones. So when we have to look upon the rods, we will study these graphs, and when we have to study about the cones, we will look into these graphs. So, and this is how in actual scenario the results are generated. So these are the first four graphs, these are the dark adapted state. Here you can see A wave and B wave. And the last two graphs, this one and this one, these are the light adapted state. So here also you can appreciate a small A wave and a B wave, but this is the pure cone function which is at 30 hertz flicker state, where you see a seesaw-like pattern. So if we just see the genesis from where these A and B waves come, so this is very simple. A waves are from the photoreceptors, that are the rods and cones, and the B wave, this B wave is predominantly from the bipolar cell and some component from the Muller cell. So any dysfunction which is happening over here, this will affect the A wave, and any dysfunction of the inner retina, it will affect the B wave. So when we use this ERG and EOG, so we have to use with conjunction with the complaints of the patient, the signs and symptoms, the ancillary investigation. So when we have got this, then the last test is ERG, EOG, and finally we corroborate all the findings to come to a diagnosis. So through some case scenario, I will come to the case one by one. So this is a 14-year-old boy complaining in the IOPD with progressive loss of central vision. His color vision is markedly diminished, it is 10 by 21, and he is giving this history since childhood, and also there are complaints of photophobia. Vision in right eye is 636 and in left eye is 624. So predominant complaint is loss of central vision, poor color discrimination, and photophobia. So so from the history only we can see probably these are functions of the cones. So probably his cones are impaired more. So this is the fundus photograph. Here you can see a speckled appearance over there. It is almost a kind of bullseye maculopathy over the central retina. His field is normal. So what could be the diagnosis? So this history is from childhood. So probably these are something which he has, which is a kind of dystrophic changes. So now let's come and we see the ERG. So here this is the normal ERG, the upper panel, how a normal ERG should look. And now this is the actual ERG of that patient. Here you see the light dark adapted state, it has a good A waveform and B waveform. But just compare the light adapted state, the 30 hertz oscillation here, the waves are markedly diminished. So this is actually a cone dysfunction. So by correlating, so this ERG itself explains that the cone system is malfunctioning. So this is a case of cone dystrophy. And this is a 14-year-old boy, but if you follow him up, so some of these patients, later on in life, they develop the rod dysfunction also. So this ERG graph is after 10 to 15 years, and here you see the flat waveforms in the dark adapted state also, that is, the rods are also malfunctioning. So finally, this patient has gone from cone dystrophy into rod cone dystrophy, he has progressed. So coming to another case, so first case was a 14-year-old boy. This is a 3-year-old boy. His mother is complaining of severe bilateral vision loss right from childhood. Intense photophobia, he is unable to pick up objects. and there is wandering nystagmus. So these complaints only say that he has severely visual dysfunction right from onset at the birth only. So just this is here you see here it is classically demonstrating the oculodigital reflex. He is poking the eye and the fundus is absolutely normal. So now if we do the ERG over here, this is the normal ERG where we should get a normal A wave, B wave and a normal cone system. But here you see all in a 3-year-old boy, all the waveforms are totally flat lines. So this is a severely dystrophic retina, that is a case of Leber's congenital amaurosis. So which is characterized by early onset, that is a onset right from birth, rapid progression, severe bilateral vision loss, wandering nystagmus, and vision is very poor from 6/62 PL positive and classical oculodigital reflex. So ERG is never studied in isolation. It is always with a sign, symptoms, age of the patient, and the ancillary investigation. Coming to next case, 24-year-old male presenting with moderate loss of vision, again poor color, defective color vision, but now he is complaining of night vision problems also. So this is also, so here only from the symptoms only we understand his cone will be gone, his rods will be also affected, and this symptom is from childhood. So this is again, so that is what he is carrying right from childhood, so probably a kind of some type of dystrophy we are expecting. His fundus more or less normal apart from some retinal pigmentary changes in the macula and in the somewhere around the periphery. So again, the OCT also, there is no major structural changes in the OCT and autofluorescence. So probably some sort of functional disturbance is there. So again, you do an ERG. So here you see, so the blue line is the control, which is how a normal ERG should be, and the black line is of that of the patient. So here we see the rods, they are suboptimally functioning because it has not gone up to the normal level in this, and also, but the cones also you see, the cones have the flat lines. So this case is a case of cone rod dystrophy. Another classical case, now this is a 14-year-old girl now complaining of only night vision problems. So from history only we see that her rods are only going to be affected again from childhood, so probably a kind of dystrophy which is non-progressive. So as earlier cases were progressive, but this is non-progressive childhood, onset from childhood, and night vision problems. Vision is normal. In the earlier cases, all where vision were either moderately or severely reduced. Vision is normal. So again, you see the fundus. This is in the light adapted state, a fundus photo is taken, and then the patient is shifted to a dark room, and again the fundus photo is repeated. You see the change in sheen of the fundus picture. Here it is bright sheen, and there it is of normal sheen. So this is a classical representation of mesiophenomena, that is Oguchi disease. And now if we do an ERG, this is how a normal ERG should look. Here I will concentrate on the rod waves, where a wave is followed by a good B wave. But if you do now see this patient, here you got a wave, but the B wave did not reach the baseline. So this is a case of electronegative B wave, which is a classically seen in congenital stationary night blindness or CSNB, and which is characterized by static disease, which will be non-progressive, normal vision, night blindness, and fundus will be either normal or abnormal, which mesiophenomena is a classical example. Again,
can you summarize? It's time.
Okay. Summarize. Okay, ma'am. So okay. So
we are running behind.
Okay. Okay. So all were cases of dystrophic changes. Now let's see some acquired diseases where ERG is useful. Now an elderly male presenting to us with difficulty in night vision. So he is complaining of only difficulty in night vision and loss of central vision. So probably again we are thinking that his rods might be dysfunctional, and he has a very chronic alcoholic, and he has been drinking for past 10 to 15 years. So we see his anterior segment was normal, his fundus is more or less normal apart from some pigmentary changes. His OCT also, there are no structural changes on OCT, but still his vision is 6/60. But since there is a very strong alcoholic history, we did a vitamin A level test, which was grossly abnormal. So now you see the ERG.
Please,
can you go
Yes,
fast?
this is the last. And now if you see the ERG, this is how a normal ERG should look, the blue line, but we see straight lines in the dark adapted state. So this is a case of vitamin A deficiency, which is affecting his rod system. So Treatment is simple. You just start vitamin A supplementation, and on vitamin A supplementation, this is again repeat ERG after 2 months, and you see all the rod waveforms have picked up very beautifully. So this is how we can utilize ERG and EOG. Actually, talk was also in EOG also, but I think.
I think you have to skip it.
Anand Kumar.
So
Any
okay.
speaker, Anand Kumar is there.
Manjunath Bhaskar.
So this is how. So ERG only will be useful only if we know about the disease, about the symptoms, and then finally we correlate all these things. Thank you.
You are very right. Actually, these are very important gadgets, but unfortunately, in the era of phaco and refractive surgery, कोई इसको invest नहीं करता है. कई स्टेट हैं जहाँ पे ERG EOG नहीं है. I can in India में है ही नहीं. It's unfortunate.